Hey, Dr. Reyes, Tubby Doc here. Let's talk about how to manage glutides or GLP1s when you stopped using it for a certain amount of time, maybe for surgery, maybe you forgot, maybe you went on some cool cruise and you forgot to bring it with you. It's been 4 weeks off. So let's talk about how to manage that so I can save you some unnecessary pain, because if you do it wrong, you will probably be miserable and you will miss work, or worse yet, you have to go to the hospital. So let's get into it. What am I talking about these glutides, better known as GLP1s? I'm talking about Mounjaro, I'm talking about ZepBound, Ozempic, Wegovy, and their compound variants, or the versions that are out there in compound. Be very careful, because if you get one of these vials and you take the maximum dose, you're going to be sick. So before we get into how to manage it, let's talk about half-life. A half-life in pharmacology is a term that we use to describe how long a medication takes to get up to therapeutic levels and also out of your system. It's usually dosed according to the half-life of the medication. So with these glutides are usually dosed every week. It takes 4 half-lives to get up into steady state. It takes 4 half-lives to be out of your system. That's important because let's say you have a surgery coming up. Most surgeons are recommending that you stop at least 1 week. The anesthesiologists are now recommending 2 weeks before surgery. So that's going to be 2 weeks that you're not on it. Most of them don't give you any guidance when you should start. Potentially, you're off the medication 1 week after surgery, so that's 3 weeks. Most people are going to be completely off of the medication for at least 4 weeks and maybe up to 6 weeks. I give specific guidance to my patients. I give them a plan on how to stop the medication and how to bring it up. Just a quick interruption. If you feel like you benefited from this video or know someone else who needs this info, then please send them this link and refer them to our channel. Let's get back to it and assume that you have been off of therapy for 1 week. Not a big deal. You can just rebound. Usually take the maximum dose or the last dose that you took. If you're 2 weeks off of therapy, by half-life, you're really around 50%. I'd recommend half the dose. The problem is what? You have single dose injection pens. So you might have to go see your clinician and ask for a new prescription so you can take that lower dose. You probably could risk going from 50% level in your system up to 100%. I've seen it done. Most of my people do fine when they're forced to do that just because the pens are not available at that lower dose. Of course, you can be clever and you can hack those pens. There's a lot of YouTube videos on how to hack the pen. If you've been off of therapy for 4 weeks, okay, it's out of your system. Do not take maximum dose. Don't do it. You will be in so much pain. I usually don't start at the beginning dose with those patients. I will go with the next dose up. For example, Mounjaro starts at 2.5. I usually will start people at 5 milligrams. Mounjaro and ZepBound are the same thing. So for Wegovy, a single injection pen, I don't start them at 0.25. I'll start them at 0.5 milligrams of the dose and then eventually get them back up to the 2.4. If you have Ozempic, it's easy, right? We can completely titrate that pen. That's why I love this multi-dose pen. All right, so if you're in the state of Texas and you need help managing your GLP-1 because you can't get a hold of your clinic, whatever the reason, you're not getting good guidance. If you need help figuring out the compound dosing, you got this compound stuff and the concentration is throwing you off, you lost your sheet, you may call, I'm licensed in Texas. If you're in another state, unfortunately, I can't practice medicine over there. You have to find a qualified person in your state. If you feel like you benefited from this video and you're ready for a consultation, please reach out to my clinic at physiciansofmedicine.com or my social media. I'll see you in the next video. Tubby Doc out.